All right. Well, good evening, brothers. Welcome to the webinar, Grand Lodge webinar series. This evening, we will be talking about safe lodge meetings in the perspective of COVID and the interesting times that we live in here now. As we've said many times before, this is not a tiled meeting, so please govern yourselves accordingly. These sessions are recorded and they will be posted off the Grand Lodge website on their YouTube channel later on. Please keep yourself on mute during the presentation. If you do need to say something, there is the space bar that will temporarily unmute you. Please send questions via the chat feature so we can cover them later at the end. And there will be a poll around about 5 minutes or so to the end of the meeting. I will put up the poll. Please be sure to submit that before you leave. And as I said, the recordings will be on the Grand Lodge YouTube channel. Upcoming presentations, we have some more presentations, one from Worship Brother Brad, who's on the call with us today. We have some from Brian Smith and another Caring for Your Masonic Collectibles. We also have Most Worship Brother Terry Tilton coming back again to talk about King Solomon. As we've talked about in previous sessions, the show and tell challenge is still in effect. This will get run through this year, and you'll get that plaque by submitting and answering questions. Now, with that done, I will stop the share. Most Worshipful, the floor is yours, so you can go ahead and share out your screen. And unmute yourself as well, because I did mute everybody.
My screen did not share, did it?
Yes, we can see the screen. We can see your presentation.
Safe Lodge meetings?
Yep, we can see the Safe Lodge meetings COVID era.
Very good. Thank you. This is going to be more of an update probably than anything new or great. We are in a pandemic, and in a pandemic that is not over. And if it's like other pandemics, it's going to come back and bite us some more before it's done. At any rate, I thought we'd walk through the various aspects that we did last time and have an opportunity, if necessary, to talk about them. And I just did this. I'm going to do the same pre-slide where we talked a little bit about your personal health, entry to the lodge, meeting site, meeting prep, degree work, post-lodge, and so on. And that pre-meeting piece is really important. And I think and I'm sorry about the small print. I realize I should have double slided. But as Masons, we need to take care of each other. And part of that is being smart and not going to lodge when you're ill. It's interesting that influenza is down 78% from last year. The reason we don't have influenza is because we're wearing masks, we're staying home. The ERs are not seeing acute illnesses, and neither are the clinics like they usually do. The South America and Southern Hemisphere influenza was way down this last year also. So it does go to show that the mixing of people and being together and all the things we does spread illness. The one we don't want to spread is the one that we're talking about today. So remember that if you've been exposed, you should quarantine. We used to say 14 days, I think 10 days now, before going to lodge or before going out. And then the other thing that I threw into that line is when the vaccination comes, get it. There's a lot of people that are anti-vaccination. The last vaccination that went through the fastest was for the most infectious disease of all, which is measles. It took 4 years to make that vaccine. 4 years. It took less than a year for us to come up with the vaccines for COVID. The difference is that the measles vaccine and the vaccines in the past have all been ground up virion, if you will, the virus itself. These vaccines are for the spike on the COVID virus, those spikes. So it's a very specific protein. It's very narrow, and it's apparently working very, very well. So when it comes around, take it. I've had it. The first one didn't hurt much at all. The second one didn't hurt much. The next day, maybe a little down, but other than that, nothing. Others have not felt that great afterwards. But at the same time, you're getting an immunization that's protective for a period of time of which we have not figured out either. We don't know in the future if we're going to need a different COVID shot each year. The way these mutants are popping out right now, that may well happen. But it's going to take vaccine to control this illness so that we can live together again. Remember that any temperature above 100.4 Fahrenheit or 38 Celsius is stay home time. That's a bad temp. And it's interesting, I got caught in the office with a person that I've seen many times. When I walked in, it just didn't seem right. It was a woman, and her complaint was she had burning in her nose for about 6 days and a change in her, she didn't even complain, but she talked about her bowels changed. And one of the things to not forget is that the GI aspects of this illness are the lead in about 20% of the time. So diarrhea or just a change in bowel habits can do it. And we all know and have heard that the nose tends to be the lead organ, if you will, for a lot of people in getting it. This is a virus that is transmitted through the nose, the mouth, and the eyes. That's basically where it's going to happen. So shortness of breath and cough, bowel changes, diarrhea, all the things that you see listed there are things to think about. It's just different. And you've got to, I think when you see these things, you go get tested. The other thing to remember is that you can be well and have it and be shedding the virus. And this is the worrisome piece, is you can shed for 3 days before you come down with symptoms or you turn positive. We know about the infectivity a little bit. It is quite infective. We don't know how much it takes to get it, but being in a small room, 15 minutes with a bunch of people, 15 minutes is about what it's going to take for you to get it. So big rooms, better. Fewer people in the room, all of that is better. And it's interesting, the day that I saw this young woman, well, she's a middle-aged woman actually, I had stepped aside to work with my computer and the EMR in my office. I'd taken my goggles off. So when I went back in, no goggles. I was 2 weeks into my first shot, and I figured, you'd done whatever you want to say. You should know better than this. And when I went out of the room and got her the COVID test and so on, I went and got my goggles back. Fortunately, I didn't get it. But this immunity from this disease, we don't know too much about yet either. We're learning. Remember, this is brand new. It's driving the medical students crazy because they figure they can go look things up. You can't. There's nothing to look up. We are corduroying new road. We're paving new road as we go along. The other thing is that we don't know what the long-term health effects of COVID are going to be. We're being surprised with post-secondary polio. Polio was a disease where a bunch of us were just little kids and had friends and so on die from that illness. Polio comes back late in life, which was a kind of a surprise to most of us. We didn't know that that was going to happen. We don't know what's going to happen with COVID. We just don't. So it's important that you continue to socially distance, mask, wash your hands, and you do that even if you've had the COVID or the vaccination. And remember, you're protecting other people from you when you're wearing the mask, but it's also, I think it goes both ways. It seems to be a very smart virus, and it's mutating quite quickly. And of course, it's going to do that to survive. It's kind of like it's got its own big brain, but it's going to do whatever it can to stay alive. And I just bring back 1918. There was a second wave of the 1918 flu when that went around, and that I think was a mutant also. It had changed, and let's figure out how to move slides, and it killed a lot of people. You've seen this slide before, or those of you that have looked at this presentation. Basically, the symptoms are all of these for COVID. And this is a kind of what's in my head after lots of years of practice, and actually as a parent and all the rest of you, you kind of know this. But just remember that COVID is a little more nasty. And I didn't put in constipation and things like that down at the bottom, but those are other factors that show up. So back to the lodge. We want you to come into lodge, to encourage, remember to disinfect. And alcohol actually works better on COVID than soap and water. 60% are better, and they're easy to use. In the clinic, we've got one that's got some type of a lubricant in it. So you're not, when you're washing your hands all the time, pretty soon there's no skin. So you want to have something so you can kind of protect your hands too. The lodge may want to temp check you and record symptoms. You can have a check off and do those type of things. It's nice to know who was there if somebody does come down with it, so that you can go back and trace and warn them. You put your mask on before entering. Really, there's no reason not to wear a mask, period. But you can do a face guard and shield also. You want to cover your mouth and your nose so that you're not making aerosol and getting other people infected. The other thing that's just come up, I think if you're watching, the CDC just came out with double masking. Fauci's been talking a little bit about it also, but it's a tight fit. A lot of these masks are a little loose on the side, and that's where the N95s are nice. But if you get a tight fit on the mask, and you can double mask with a cloth surgical or double surgical or whatever, and you're kind of at that 95 to 96% with a tight side. So that's pretty good. Shaking hands, just remember that that's a way of transmitting. The namaste is still the old Hindu namaste. It's a way you can do it, or bump elbows, whatever you want to do. Social distancing has not gone away. Temperature we've already talked about. And a sign in, roll call, whatever you do, have a way of keeping track of whoever was there that night in case you need to track them down because of exposure. Encourage you to keep your hands away from your face. The nice thing about face masks, and I knew this, I learned it in surgery. when you're in the operating room, you're not supposed to touch your face and touch the wound. You know, you're supposed to keep your hands sterile. So you learn not to have your hands on your face, and the mask and goggles or a face shield, all that will help you do that. Just keep your hands away, because the hands are one way to transmit the virus up there. And then, as we've talked about so many times in the past, you want to follow the local, federal, and state guidelines. Those are important. I haven't changed my feelings about airing out the room a couple days anyway between use, just to kill the virus off. We know that the virus is not on the fomites on the surfaces that much, but it can be. And it doesn't hurt to keep things clean. Lysol is a good disinfectant. Bathrooms, use your judgment. You want to keep some space, maybe a couple at a time. Wash your hands frequently, ventilate the room, open the windows. But now we're in the middle of winter, and if you open the windows, the cold will come in fast, I guess. And then small spaces I talked about before, like an examining room in a doctor's office. Boy, I don't like more than 2 people in there, myself and the patient. And you start getting more, 15 minutes, you can easily transmit. And then if you start bringing in a lot of family and others in these small rooms, it gets a little tight. And then the room needs to be disinfected after each use. These rooms are, I think you've already done this, set up for social distancing, and disinfectants are available and all the other pieces. If you have to use gloves on a ritual, go ahead. They should be probably cleaned or whatever afterwards, certainly air it out for 4 days or so. Face shields are helpful with a mask. And I make the comment, always do the best face covering is one that you'll wear. Masks and face guards required in the building. And again, I talked about recording attendance, redundant, sorry about that. As a Mason, if you're going to be doing work, know your work. You should be able to walk through that work and have it down and make it succinct and concise and move it along and get done. If there's a place where you have to touch, you could use gloves, certainly disinfectants and other things, but as much as possible, make it a touchless degree. The master we've suggested should mask and probably a face guard or shield, but certainly masks would be in order. In the clinic, we're wearing, what I wear is a mask. I'm not double masking yet. I don't know if I will, but then a mask and a face, I use goggles. And the goggles to me work very well. And I think that that would be appropriate also. When you cough, sneeze, sing and all that, the aerosol that you blow out goes out about 20 feet. And I think of the picture of President Trump when he was at Brainerd before, right when he was getting it. There's a picture that somebody took when he was talking, and you can see the spray coming out of his mouth. It was just kind of an interesting picture. But the point is that it does do that. Food and drink, I think we're at the point right now where you're allowed to bring your own fluids. Ralph can disagree with me if that's not the case, but I think we've, as long as you bring your own and use your own water or fluid, whatever you're going to use, that should be okay. Robes, we suggest that they have a couple days, 4 days in between. And what we do in the clinic is we like to wear a washable top, a scrub or something that you can take home and toss in the washer or the dryer. We tell the med students the same thing. Dispose of the disposals, disinfect, move room air, social distance. Lobbies are kind of a bad place. And if you have a big place, I think of the Duluth Temple. We have a whole lot of different places where people can go. You should go to your room and stay in your assigned room. If you're going to switch, sign in and go through a temp check in the next room also as you move around. And then not a lot of congregating in that joint space. Protect your eyes and mouth. Don't touch your face, ventilation, all these things we've talked about. The question is, when will it end? We were thinking, and we've kind of been using this at the U, that it was going to be after the second quarter. But now I think we're leaning on to the third quarter, and we just plain don't know. It's interesting, in the last day or so, there's been a marked drop in the number of hospitalizations and number of deaths. What is the Super Bowl going to do? Don't know. And what are these new mutants going to do to us? We're not sure on that one at this point either. My hope is that we can beat this thing, immunizations, social carefulness, masks, and so on. All of these things so that we can isolate the virus off and let it die off would be kind of nice. So with that, and I haven't had a chance to follow the chat, so I don't know what's in it. Guess I can't see it. Are there questions?
So, brethren, I don't have any chats or any questions in the chat, but please feel to unmute and ask your question.
Yeah, I did try and put something in the chat. I guess I must have messed it up because it didn't go out. But my question was this, most worshipful. If you've been immunized, can you still pass the COVID virus to other people?
We do not know. Now, my answer to that's going to be, if you're immunized, the answer is yes, we do know the answer to that. The immunization is the spike protein. It's not the virus. No virus, just the protein. And what happens is the body takes that protein and builds an antibody to it so that it can fight off the virus when it comes. Now, I've had COVID and you get immunized, I don't know what happens at that point. We don't know for sure how long you're going to shed COVID afterwards. It seems like after a couple of weeks, people are pretty good. And then if you've been immunized, then you're back into the immunity one with the vaccination.
Where my question was going was, let's say you've been immunized, but you've been exposed now after your immunization to someone who has COVID. Now, you may not show any symptoms, you may not get COVID because you've been immunized, but can you still transmit it to someone else?
You can't transmit it unless you get the disease.
Okay, thank you.
Worship Brother K, please go ahead.
Most worshipful, I have a question. With the immunizations that are out, both the Pfizer and the single shots, if you take those inoculations and then there's supposedly 23 plus more, 23, they've located more variations of COVID, you can still catch one of those other ones, correct?
Maybe.
Oh, they don't know for sure yet, huh?
We don't know. So here's where we're at right now. we have a lot of concern about that. So just accept that up front. But the spike protein that we are immunizing against, hopefully is going to cover the mutants. And it apparently is covering some, we're not sure. South Africa had problem with what they have, AstraZeneca or whichever one they had down there, and they've decided not to use it because of that concern. It's a nasty damn little virus. And if it's going to start going through this mutant business on us, it's going to take us a while to get our arms around it. So the better we can hold it down, and the reason for all of the stuff that we're doing in society is to keep the trans down and try to isolate it and try to snuff it out if we can. And we haven't been able to do that. But our hope right now is that the immunizations are going to be helpful with the mutants. But stay tuned.
Thank you. Brother David, you have your hand up?
Dr. Christensen, how does this vaccine work with animals, and is there an animal vaccine? I know like animals are known to spread the disease as well.
Well, it's interesting. We know that the mink had it and Denmark killed them all. And also that it's gotten into dogs and some other animals. I do not know what they're using in vet medicine. From what I've heard, I haven't heard of anything right now, and I'm not sure how deep it penetrates. If it's just a dog here and there, I know that they had problems with the mink, and they euthanized them. They just got rid of them. So if that stopped it or not, I'm not sure, and that's probably as deep as I can go with the answer. And I haven't heard of anything for vet medicine at this point.
So, Most Worshipful, what is your thoughts on how the new J&J vaccine will affect the rollout process, or the vaccination rollout process? Do you think it'll improve it, or what's your thoughts around that?
If it's
If it's
released for use,
Mhm.
then we'll have 3. And the general feeling that we have been saying all the way along is if you can get an immunization or a shot, vaccination, take it. That's been the advice. So it's not necessarily Pfizer, Moderna, J&J. It's if you can get one, take it. And apparently, if you can get by with that, if they're going to have a good one-time shot, it'd be a lot easier. The 2-time shot is a real bear because we don't know how close it has to be on top of each other. Mine was 4 weeks apart. Pfizer's 3 weeks. And with J&J, you go get the shot and you're done with the darn thing. So,
Right.
And I think that the percentage of coverage, all of these vaccinations are much better in their ability to prevent the disease than any of the immunizations we've had in the past, basically, with other diseases. So we're looking, I think it was 75 or more % on J&J with a one-time shot. And there was a lot of discussion when Biden went in of taking Moderna and just giving one shot. And I know that at 2 weeks when I was exposed, I was about 45% covered at that point. And then it just keeps going up 2 weeks later and as it goes.
It improves over time, right? It's
Right. And the other one, I guess that's worth the Russian one, and the Sputnik one has turned out to be okay. I think some of the others haven't worked out so well. And we got a whole world that we need to immunize. So this is going to be interesting.
Yeah. Thank you. Brethren, any other questions? Well, I'm going to
Send
put
me
up,
an email and I'll send you the slides if you want them.
absolutely. Thank you. I'm going to launch the poll here real quick. So please, if you would do that. If anybody else, while we're doing that, if anyone else has a question, please feel free to ask away.
I have one more, Most Worshipful.
Please go ahead.
If I've with a couple of brothers, it's common knowledge, been exposed. One of them went to the VA hospital and he's got specialists there, and it came back inconclusive. And I was directly exposed. His wife and myself had no symptoms. We all tested, of course, and came back negative. We all know how those tests could work. But the brother that had it was inconclusive with the VA doctors, even though he had all the symptoms. He was pretty sick.
As a physician, one of the things that's really important, and it's the same in any of your, whatever you guys do for a living, the knowledge that you have and what you learn from listening and talking to people probably trumps the test. The test is a test. It has sensitivity and specificity. Is it good or bad? They aren't necessarily the greatest. The PCR tests seem to be the best one. Antibody tests, not so good. So testing is tough. And the VA has got the same problem we all do. I think if you think you've got the symptoms, you treat it that way. And those of you that have been exposed do just exactly what you did. Now, we may get a test someday. I swear, a year ago at this time, I was in a plane. I was in DC, Mexico City, and I left Orlando right before everything closed. That was right after I got back. And there was some crazy stuff going around. And I don't know, maybe I did, maybe I didn't. I ended up doing a PCR test not long ago, force tube, not because I was exposed, it was negative. So I don't know. This is an interesting illness.
Thank you, Most Worshipful. Anyone else have questions that they would like to bring up?
I think one other thing I would say that I want to thank Ralph Whitstrom for the work that he's doing on this. He's put an awful lot of time in making the COVID committee work and pulling things together for the Grand Master and for himself going forward. I don't know what next year is going to look like. It's not a fun time being Grand Master, and we need to support our leadership.
Absolutely. And so with that, I will turn it over to Right Worshipful Ralph for our final comment of this evening, as tradition is. If you want to unmute yourself, Right Worshipful.
I think I'm unmuted now, correct?
Yes, you are.
Oh, okay, wonderful. Yeah, we covered a lot of the stuff on Monday too, only Ray wasn't there, just so you know. He
Blew
didn't
it.
make it.
I blew it.
I wasn't going to tell him.
I apologize. It was 25 after I tried to get in and it was too late. So they only met for 10 minutes, I think.
Right. Yeah, that was as long as it was.
I talked for a lot longer than that. You can ask Adam. He'll remember. But things have been going well. The committee has worked very well, and we're doing the best we can for the membership and trying to be fair to everyone as much as possible, saying that we are responsible. We are our brother's keeper, if you will. And so far, I think things have been going well, and people have been, for the most part, very cooperative. So I want to thank the craft for helping, because that's where it happens.
It is. Thank you. All right, Worshipful. And with that, I'm going to stop the recording.